Good afternoon, ladies and gentlemen. A very warm welcome to today's session. My name is Kevin Hiohu, the Program Officer for the Research Hub, currently working at the National AIDS Control Council. We'll take a few minutes just to wait for a few additional people who may be joining us for this session, and then we'll begin right after. Once again, good afternoon, everyone. As I said, my name is Kevin Hiohu from the National AIDS Control Council. And today's session is on adolescent interpretation of HIV media messages, and more specifically, assessing the effectiveness of the Trust Condoms Kuwa True campaign. And our speaker for the day is Khasiani from the National AIDS Control Council. She is currently the acting head of communication here at NAC. I will let her introduce herself more officially on her own, and then we'll get right into listening to what she has for us today. So, Mercy, please take it away, introduce herself, and let's begin. Just hold, allow me to turn on Mercy's audio. You can hear her clearly. There we go. There we go.
Thank you very much, Kevin. Today I'll be making a presentation on adolescents' interpretation of HIV media messages, and I would like to assess the effectiveness of the Trust Condom Kuwa True campaign. You would probably be wondering why I chose adolescents and why I decided to talk about HIV media messages, and probably why I wanted to find out whether these messages are effective. First and foremost, we all know, and research has also shown that the mass media communication has played a major role in the response to the HIV and AIDS epidemic in developing countries. And secondly, that communication at the center of the response, and that it plays a supporting role to HIV and AIDS programs. The reason why I chose adolescents is because we have seen that Kenya has a decline in HIV incidence rates among adults. We had 19% decline if we look at it from 2000 to about 2015 thereabout. And we see that we moved from 105,000 new infections to approximately 77,000 new infections in 2015. And this possibly was due to the scale up of the various prevention and treatment programs with support and with the supporting role of communication. And therefore, I decided to look at this because we also realized that when we come to adolescents and young people, that the progress is not similar to that of adults. So I'll begin my presentation. The reason why I chose the condom is because the Kenya Demographic Health Survey informs us, this is the one for 2014, it informs us that condom use is one of the most effective strategies for combating the spread to HIV and AIDS. And we know that 93.7% of all new infections in Kenya are sexually transmitted. And thereby, if we are to reduce new infections, then we would go the condom way. So I wanted to find out why it is that people aged 15 to 24 years contribute to 51% of adult new infections in 2015, which is the 77,647. I also wanted to find out where the problem was, and yet research had shown us that media or mass media in itself played a major role in the response. And therefore, I decided to interrogate one of the mass media campaigns, which is the condom advert, so that I can be able to understand why this is the case and why adolescents and young people still bear the brunt of the epidemic. So basically, the Kuwa True campaign, or Kuwa True in itself, is a Swahili phrase, be true to yourself, and can be translated figuratively as show your truth or be comfortable in your skin. So this campaign actually aims at encouraging young people to put the Trust Condom back into their sexual plan. This is according to PS Kenya. And as we know, or from a communication point of view, we know that language actually influences thought, judgment, and how meaning is constructed. And therefore, I wanted to look at this Kuwa True as a phrase and understand how it actually influences the thought and the judgments of the young people, and if they actually get the message behind it. I carried out this study in Kisumu County, and from our county profiles, we know that Kenya's HIV epidemic is geographically diverse. It ranges from a low of 0.4% in Wajir to a high of about 25.7% in Homa Bay. And 65% of the new HIV infections in the country, they come from about 9 counties, Homa Bay, Kisumu, and Siaya being one of them. So I chose Kisumu because of proximity, and also because the characteristics of Kisumu and Homa Bay were almost similar. So as I had earlier alluded, we had seen a 19% reduction in all of the new infections in Kenya. That's between 2013 and 2015, which shows good progress with regard to new infections and with regard to our journey towards eliminating HIV and AIDS by 2020. But again, on the reverse, when we look at the adolescents, that's between 15 to 24, that is adolescents and post-adolescents, we find that there is an increase in the new infections. We have approximately 17% increase in new infections. In 2013 to 2015, we had 29,352 infections in 13 and 35,776 in 2015. That was a great increase, almost 17%. So from what we had spoken before, or from a communication point of view, research has shown that communication campaigns have not been successful among this group. And this, they said, was because of a lack of understanding of the communicated message. So if we are to get to epidemic control of HIV in Kenya, we can only realize this if we have effective interventions that are put in place that can slow down the spread of HIV among young people. So what's the significance of this study? This study contributes towards achieving the results of the Kenya HIV and AIDS Strategic Plan and the Kenya's Fast Track Plan to end HIV and AIDS among adolescents and young people. So, based on this particular study, then decision makers can be able to make informed decisions on the approaches to take when developing effective HIV risk communication messages. So I would like Kevin to play the advert, the Trust Condom advert that I was interrogating, so that by the time we give the findings, we can all be able to be on the same level to understand where these adolescents were coming from, and if this particular campaign or this particular communication piece was effective in giving the message that it intended to. So Kevin, kindly play us the Trust Condom advert.
So as Mercy has stated, we're going to play an advert from
when people look
one
at
of the
me,
ads that
they see
Kuwa True
what they want to see.
campaign.
They don't really
let's
know
see what
me.
that looks
They
like.
don't look past the surface to what's inside. They know me. They don't look past the surface to what's inside. Am I pretending, or are you just too blind to see that there's so much? When people look at me, they see what they want to see. They don't really know me. They don't look past the surface to what's inside. Am I pretending, or are you just too blind to see that there's so much more to me? There's something unique inside me. That thing that's so rare, that makes me me. I let go when you're not looking. When you least expect it, I surprise you. Because the only time I'm truly free is when I'm just me. See, see my true colors. See the true me.
Trust Condoms, Kuwa True.
So basically, that is the campaign that I was looking at, and I asked myself, where is the disconnect? We have had so many communication campaigns, so much information out there targeting both the general population and even adolescents, and yet we are achieving results when it comes to the adult population, but when it comes to our young people, we realize that we actually reversed the gains. So I wanted to find out where the disconnect was, and that is why I used the Trust Condom advert. So this study sought to find out how the young people interpreted HIV media messages, and it was informed by Strathol's media reception theory and the cultural risk theory. A mixed method approach was used for the case of Kisumu County. Questionnaires were distributed in school and out of school, and feedback was received. One in-depth interview was conducted with the brand manager of PS. 4 focus group discussions with a membership of 10 were held, 2 in school and 2 out of school. The schools that were visited were Zaverian Secondary School, that is in Kisumu town, and Chulaimbo Boys, that is in the rural areas. So we looked at both urban and rural. Then for the out of school youth in town, we interviewed the youth from Kondele for the urban, and for the rural, we interviewed the youth from constituency. Then a reception analysis was done with each of the focus groups, and these are the findings we got. When we asked the questions, what is the advertisement about? Only 26% of the respondents clearly understood that the Kuwa True Trust Condom advert was about the Trust Condom. As you can see from the graph, a significant number of people felt that it was about relationships. Others thought that it was about sexual protection from HIV and unwanted pregnancies. And we had other varied responses that could not be actually put in a specific group. So these findings can be explained using Strathol's 3-subject position theory and Frank Parkin's argument class position. According to Parkin, class position, which includes the income, the type of employment, and education level, they play a big role in shaping an individual's meaning system and view about public affairs. We brought together youth for this study, and as you can see, some of them were in school and others were out of school. And therefore, the issue of education level comes to play. Those that were out of school were employed because some of them were border riders, others were housewives from the house. You find the issue of class and income also has an influence. And as we are told by Parkin, these class positions, they actually have a big role to play when it comes to shaping an individual's meaning system and how they view public affairs. So what is the advertisement about? Given that this study included adolescents from both rural and urban settings with varying education backgrounds, it is likely that the differences in interpretation originated from social settings rather than the individual. The revelation that 74% of participants had a different interpretation of this advertisement, and this confirms that meaning is actually multi-layered and multi-referential. It also proves that the audience are capable of producing their own meaning from media text outside of the structures of those texts. So if we look at some of the responses that we got from the study group with regard to Kuwa True advert and what it was about, you can see that some of them were actually far-fetched. If you look at Respondent 1, for example, when we asked, what do you think the advertisement is about? And some of this information, or rather all of it, verbatim. So you'll find that it has some spelling mistakes, which I did not change. I just put them as they are. Respondent 2 told us that the relationship between two parties and future of life. So once they look at the Trust Condom advert and you ask them, what was it about? Respondent 2 felt that it was about relationship between two parties and future of life. Respondent 3 believed that it was how to make your life safe and future life healthy. Respondent 4 felt that it was about lessons on future life. Respondent 5 felt that it was how you can trust your friends or control your relationship. Respondent 8, true concern of lovers with their relationships. Respondent 14, it's about believing in oneself. Respondent 16 felt that this particular Kuwa True Trust Condom advert was about entertainment, dances, dress codes, and acrobats. Respondent 17, dress codes and beautiful girls. Respondent 23, prevention from HIV and pregnancies. Respondent 24, the girl in the advert is attracting the men. That is what Respondent 24 felt that the Kuwa True advert was about, attracting the men, encouraging sex among the youth, sincerity in a relationship. So you can see all their responses varied. And if we go ahead and look at the second question, which wanted to find out, are HIV risk communication messages interpreted accordingly? From our analysis, we found that no, they are not. They are not interpreted accordingly. The study shows that there is a discrepancy between the intended and the perceived meaning of the Kuwa True. While some participants interpreted it as being real and truthful, the standard interpretation was actually far-fetched. And remember, in the beginning of this session, I had brought out exactly what PS Kenya had believed that the Kuwa True was about. For them, it was a Swahili phrase, be true to yourself, which can also be translated as show your true colors or be comfortable in your skin. And it was about encouraging young people to put the Trust Condom back into their sexual plan. So if that is what this advert was supposed to do, it was supposed to encourage young people to put the Trust Condom back into their sexual plan. And yet some of the interpretations that we were getting are like is attracting men, prevention of HIV, and the dress code and a beautiful girl. You find that actually it did not reach or did not achieve what it intended to. Then the focus group discussions with in and out of school adolescents also confirmed that majority of their interpretations were pegged on past experiences and worldviews and some thoughts and experiences or things that actually did not have much thought. So, with regard to message interpreted, how did you interpret the message of this Kuwa True? Some of the responses we got have also been highlighted. Respondent 1. According to Respondent 1, the life of a youth and how they behave. That is how they interpreted the message behind the Kuwa True campaign. That it was all about life of the youth and how they behave. The advertiser tries to help the youth on how to be self-dependent on their day-to-day activities and should not be discouraged. As I said, I took the responses as they are. I did not make any amendments. I put them as they were responded. Respondent 3 felt that the funny shaving of the woman symbolizes the digital, the new ways of living styles. That is shaving. I think this particular respondent was trying to talk about the hairstyle of the young man who had cut his hair. So according to this respondent, when he watches or she watches the Trust Condom advert, the meaning interpreted or the meaning behind it is about the funny shaving. Respondent 4, people should be free with their partners. When they watch this, Respondent 4 felt that what the advertisement was trying to tell them was that they should be free with their partners. Respondent 7, a guy with the Kuwa True condom can get any girl and is assured of being safe. That is the meaning this particular respondent gets from that particular advertisement. And if we look at Respondent 9, we find that this particular respondent felt that the advertiser is trying to inform and to tell the individual to be realistic. So basically, those are some of the responses. I picked just a few for this particular presentation so that you can understand the kind of interpretation that our adolescents have, or the type of meaning that they put on some of the messages that we actually put out there for them. There are some others here. You can see Respondent 11. Respondent 11 felt that the Kuwa True advert, the interpretation behind it was that it interprets the entertainment by the long-haired man and acrobats. Respondent 12, my interpretation based on the advertiser's interpretation is that all the lures girls, I think what he or she tried to say is all that lures girls is how the boys dress and the action they portray when they are together, and that makes them happy. Same to boys feeling towards girls. That's what Respondent 12 thought. Respondent 21, that youths should have a dress code. Respondent 24, the moment the girl sees the condom, they give in. That's what they believe that this particular campaign was all about. So based on my analysis, these findings reveal that there is always a chance of various degrees of understanding and misunderstanding in any communication exchange. These different interpretations, perceived by television producers and viewers, are based on structural differences of relation and position between the broadcaster and the audience. That's according to Strathold. So I also wanted to find out what causes the gap between HIV knowledge and HIV safe sexual practices. So for this particular question, I asked the adolescents if the condom does prevent an individual from getting infected with HIV. And it's interesting, you can see from the pie chart that about 35% of them believed that the condom did not prevent an individual from actually getting an HIV infection. So from these results, it shows that comprehensive knowledge of HIV prevention methods is lacking for a significant number of the adolescents. And from their limited knowledge, these adolescents make impulsive interpretations, which are pegged on experiences and worldviews. So I used the Cohen-Kappa statistics text on level of agreement so that I can see the level of agreement between the intended meaning and the perceived meaning of the Kuwa True Trust Condom campaign or advertisement. So it was used to measure the level of agreement between the advertiser's message and the respondent's interpretation of that particular message. So the strength agreement for the Kappa coefficient was rated as 0.21 and below, that is less than 0.21, was fair. then anything between 0.21 and 0.40 was rated as moderate, and anything between 0.41 and 0.60 was rated as good, and anything between 0.61 and 0.80 was very good. So if we get the level of agreement or the kappa to be anything between 0.6 and 0.8, then we will know that the level of agreement was actually very good and that the audience actually interpreted the message as it was supposed to be interpreted. So let us see what our study revealed. So how effective was the Kuwa True Trust Condom campaign? Based on the results that I have shown, and using to indicate a degree of understanding and misunderstanding between advertisers' message and the respondent's message, we found that the level of agreement was actually 0.16. We had a kappa of 0.16, and if we go back, we had said that anything between 0.21 and 0.4 would be moderate, and anything below 0.21 would be poor, and therefore our kappa is 0.16. What that means is that the level of agreement between the advertiser's message and the interpretation of the message by the respondent was poor. So what's our conclusion? We conclude that for any HIV risk communication to be effective among adolescents, the message should be designed from a research point of view and not vice versa. We also felt that all HIV communication messages must be tried and tested before they are executed in order to achieve efficiency, for us to have the same level of understanding, so that once these messages go out there, the adolescents actually get what this message is to say, so that when they find themselves in a place where they have to make a decision, this decision is made from an informed point of view and not from a point of view where this particular individual is lacking information or knowledge. Thank you very much.
Great. Thank you very much, Mercy, for that very informative presentation. I think I want to throw you a question, or rather maybe a request based on what we've just seen on your presentation. I think it would be interesting to see the results disaggregated maybe by what you got from the urban setting and what you got from the rural setting. Probably that would help to see how we can standardize messaging to be acceptable both by the people in the rural settings and the people in the urban setting. For me, that's just more of a request. I'm sure that would be interesting to see. But for my question, maybe as a communications expert, have you thought of any, or have you had any ideas as to how messaging would be done?
Thank you very much, Kevin. From your question, have I thought how messaging should be done, probably in future or following the results from this particular presentation? I think my answer to that would be yes, and not just me as a person, but me and the whole of the communication team at the National AIDS Control Council. We have actually sat down as a team and come up with a a communication plan, an agenda for the Kenya AIDS strategic framework. And the first thing we did is we realized that yes, so much information is going out there, but we really don't know the impact of this information. We attempted to do an impact study on the same to see how much the mass media has actually influenced the HIV and AIDS response. And just like any other research that has been done in the previous years, our impact study showed that communication actually played a role in the response. But the problem here is not how impactful it is. We wanted to see why we are not getting the same results when it comes to the young people. So we actually disaggregated our audiences, and we ensured that the young people were actually captured, and we put together a communication technical working group that was going to look at all HIV and AIDS messages that are supposed to be aired or transmitted across the country. Then once these messages have already been done, we will then put them in the various counties or the various populations, because we have seen that we have a diverse epidemic. The epidemic in the Nyanza region is not the same as the epidemic in the northeastern region. So these messages will be tested by population or by the segment of the audience to see how effective it is before we pump so much money on these communication messages that may not be having much impact or results when it comes to a specific audience. We are not saying that the mass media messages are not impactful. No, they are very impactful. The only problem is we are not getting the same result for adolescents and young people. That's between 15.
Great. Thank you for that. Probably let's what I want to do is I want to play the video again. Have the audience just give it a second look, and then let's hear from the audience what is your interpretation of this Kuwa True ad. And then probably after that we can take a few questions from the audience. And to the audience, remember, if you want to make a comment or to ask a question, there's a chat box on the bottom of the screen where you can type your comment or question, and I can see a couple of people already airing their concerns. So let's just have a look at the video, and then let's see what the audience has to say about how they interpret the message being portrayed in the video. So let's have a look at that.
When people look at me, they see what they want to see. They don't really know me. They don't look past the surface to what's inside. Am I pretending? Or are you just too blind to see that there's so much more to me? There's something unique inside me. That thing that's so rare, that makes me me. I let go when you're not looking. When you least expect it. I surprise you. Because the only time I'm truly free is when I'm just me. See my true colors. See the true me.
Trust Condoms, Kuwa True.
So that's the Kuwa True advertisement, and as we think of and just type in the comment box what our interpretation of that particular advert is, Mercy, our presenter for the day, will just go ahead and tackle a few questions and respond to some of the comments that have been typed out by the audience. So, Mercy, please take it away.
Thank you very much, Kevin. Charlene, I can see your comment that this is a great study. As part of the recommendations, there is also the aspect of involving the target audience in developing the message. In this case, involving adolescents and young people in developing the Kuwa True advert would have probably brought out the different results. And yes, I totally agree with you, Charlene. And this is one of the things that we have done when we came up with the Communication Tech Working Group. Part of the Communication Technical Working Group we have formed as National AIDS Control Council has representation from adolescents and young people. So that means that any communication that will have to go to the young people and adolescents has to have a review by the young people for them to give us the best way in which this particular message can be sent out. And secondly, I have also seen another comment from Ann Bitkihara. There is certainly the need to relook at age-specific comprehensive sexual education and to consider the evolution of communication language amongst this group, e.g. normal, Sheng, Kiswahili, or that. And I totally agree with that. Once we come up with the messages, maybe we will have to also consider translating them into the various languages so that they can actually be comprehended from that particular point of view. And also, in addition to that, language plays a very role in influencing thought and judgment, and also on how meaning is constructed. And therefore, I totally agree, because I know once we put in the different versions of the languages, then the audiences will be able to actually think in their mother tongue, or rather interpret it in their mother tongue, and will be more effective than when they're supposed to first translate it from a specific language into one that they can understand, and it can actually elicit very different interpretations. And Beatrice Kihara, there is too much happening in this tape. We at the workplace, in the disco, and then the condom, we need to focus on the primary message. I also think the adolescents actually, the advertisement was too busy that they actually forgot the content. As you can see from some of the responses that we had, some of them were looking at the person with the hair, some were looking at the tattoos, at the dance, at the shaving styles. For example, you can see this one. Where is it? This one. The funny shaving of the woman symbolizes the digital, the new ways of living styles. And you're supposed to be interpreting it. So it means that they actually forgot about the content, about the advert, about the meaning and the message behind it. And they were looking at what was happening within the advertisement itself. So I totally agree with you, Anne. We need to make it less busy so that the focus of the person who is watching is on the message and the content, and not everything else that is happening around. Maybe the advert should have been a bit shorter. Yes. Any other questions, or we could actually, I can see Frida. Thank you, Mercy, for the great presentation. I recommend a similar study in more counties, maybe medium incident counties. Yes, this particular study was carried out in among one of the counties that is in the high incident regions, that is Kisumu. As you can see, it among the counties that contribute to actually 65% all the new HIV infections. So probably we should, or I should, take the initiative to do a similar study, but now in a medium incident cluster or a low incident cluster. We should probably look at Wajir in the low incident cluster and see if communication has anything to do with it. But we also need to remember that communication in itself is not sufficient for preventing HIV and AIDS. It is not. Communication is, it actually just, it supports, it plays a supportive role. So what will actually use these new incidences is actually scale up of various prevention and treatment programs. And once we scale up the various prevention and treatment programs, then communication comes in to support that, to ensure that these prevention programs and treatment programs are actually scaled up. So communication in itself will not and cannot be sufficient in HIV prevention. Thank you very much for your comments. Thank you very much for your questions. I believe I have answered each and every one of them. Kevin, you could assist me to see if there's one that I have left out.
Right. I think also I want to I want to look at a few comments that have also come in. I see Anbichis Kihara also said that this is a good study which clearly shows that the audience is more visual and not paying much attention to content. We may need to have disaggregated the data into adolescent grouping to see if there were any significant differences. And I think that also tied into the earlier comment made that it would be interesting to see the data also disaggregated by the setting, whether urban or rural. Thank you, Anne, for that comment. I think I saw another one here. Brian Otieno, thanks for your comment. You say that I'm impressed with the results, for they truly reflect what most young people thought about the ad. A recommendation to this is that it may not be enough to just engage the young people after developing the ad, but before. Seemingly, this ad communicated only to the rich kids and less to that young man in Kibera or Madare. And I think I tend to agree. We do need messaging cuts across various settings, the rural, urban, and different economic settings as well. Brian Otieno also continued to say that in the responses, there was one with a view on encouraging sex, if I'm not wrong. Ads should in a way give options, for example, abstinence, for their young people who are also embracing this too. Maybe I'll let Mercy react to that in a bit. Philip Bill Okaka, by any chance, did you sample island communities of Lake Victoria, e.g. Mfangano? I think I'll also let Mercy react to that. Who says that she likes the approach used in evaluating the videos and communication materials for adolescents and young people. Thank you very much, Laura, for that. So maybe I can let Mercy react to the question about sampling of island communities of Lake Victoria, for example, Lake Victoria.
Thank you very much. With regard to probably sampling some of the populations around the lake area, such as Mfangano, I think that would be something to consider, because this was actually a small study that I did just within Kisumu to quickly see what this is all about, so that I can actually advise, or probably while sitting from a place of influence, I can say, I don't think this works, or I think this works, and maybe we should look at it this way or that way. So just based on this snippet from the case of Kisumu County, I believed that there was a problem. And I actually agree that we can sample some of the islands. While doing the study, remember I said with a small survey, I realized that some of them had not heard of the advert at all. So I had to play it for them and bring them the posters. And those that had seen it, majority of them had seen either a billboard or a poster on a shop, or the window of a shop. So I had to play it for them. And I think I totally agree with the language issue, because one of the challenges that I actually experienced was that when I went to Kisumu Rural, now where I was at talking to the out of school adolescents in Seme, I realized that they were watching and getting very excited, but when I started asking the questions, it's like they did not understand much about what was being talked about. I actually got my responses in Luo, and I had to get somebody to transcribe that for me. And yes, I totally agree with sampling island communities to actually see what's the best way for us to communicate HIV and AIDS among this group, because this is the future population, and if we are get to zero, then it means we have to actually close the taps to new infection with regard to this age group. And if communication support us in doing this, then what a better way than to find the best way to look into all the populations that we have, especially in the high incidence clusters. Yeah, I agree with you. Victor Odero, Mercy, were the respondents' economic and academic backgrounds considered during the research sampling? When I was doing my sampling, when I chose to do adolescents in Kisumu, what I actually wanted to look at was in school, out of school, and education level. So I didn't actually look at the economic aspect, but I actually looked at the academic, because I was taking out of school youth, and from my questionnaire I wanted to find out if you are an out of school youth, what is it, drop out, or didn't you ever go to school completely? And then, as you can see, I also had in school youth, and I wanted those between 15 to 19 only. Anybody who was above 19 and anyone below 19 was actually excluded from the study. So academic background, yes, was considered. Economic, no, I didn't consider that. But as the study went on, I realized that most of the out of school adolescents were actually working. They were border youth. They were either riding a border or a matatu, so they were actually economically empowered. The only problem was girls. The girls between this age 19 to 15 that were out of school, this particular population was not working at all, and most of them came for the focus group discussion with children. So there were adolescents who were also parents. Some of them were married, and some in cohabiting a relationship were just totally not in any relationship, but they were staying at home and didn't do much. So yeah, the economic, I didn't consider it, but it somehow it somehow showed itself during analysis. And I think I've answered all the questions, Kevin, unless there's any other that I have not seen. Let's see. And Beatrice, HIV spread amongst adolescents need to be contextualized to understanding their social activities and this advertisement, such as drug abuse, drug dens, early sexual debut, multiple partners, commercial trafficking, social solicited sex, slay kings and queens, I like that, to broaden the interpretive meaning associated with the same. Wow, I think that's a very good comment. It needs to be contextualized. So if we are actually going out there and we are going to be sending messages to our young people, we need to contextualize them based on the context. Yeah, I agree with you. I don't think there's any other, so back to you, Kevin. But I can see Laura is typing and Bill. Philip, Bill Okaka, thank you very much. I could have missed it, but by any chance, did you consider sexual history of rest, e.g. time, age, or sex debut? I actually did, Bill. In the questionnaire, in the survey, I actually asked them, one of the questions that I asked, let me check my questionnaire, please give me 2 minutes. One of the questions I actually asked them is, have you ever had sex? I did ask that question. And the only thing I did not do was ask at what age. But before they answered the questions, I had to ask them if they had, and if they hadn't, then answering the next question was going to be optional, because I wanted to ask if they had used a condom. Because that place now, I wanted to relate how interpreting of this message was going to actually play when it comes to decision making. Bill, I can see you, I don't know if this is a comment or another question, that significantly affect perception of information. Okay. Oh, yeah. You're trying to say that this kind of information can actually affect the perception of the information. Yes, that is true. And as I've answered, yes, I did find out about the shawl, but I did not find out about the age.
Thank you. Thank you very much, Mercy. This is absolutely amazing work in looking at the effectiveness rather of giving messaging adolescents and young people. I believe there are no more questions coming in, and we're about to hit the 1 hour mark. So I would very much love to close the session. But I have to thank our audience. You've absolutely been amazing. Thank you for your comments. Thank you for your questions as well. And I believe these will inform any further work that Mercy will do along this area of interpretation of HIV media messages. So thank you very much. A quick reminder, if you want to receive invitations to more, or rather our future webinar sessions, please go to maishamarifa.org.ke and sign up as a member of the Research Hub, and we will send you invitations whenever we have a session. I'll leave the link in the chat box, and any other comments that are coming in will be forwarded to Mercy via email, and she could probably handle those, and I can send the responses back. So thank you very much to our audience, and thank you very much to our presenter of the day, Mercy Khasiani, the acting head of communication at the National AIDS Control Council. Before we close the session, another quick reminder, if you're part of our audience and you do have interesting work that you would love to show on our webinar sessions, do not hesitate to shoot me an email. I'll leave my email address in the chat box as well. Get in touch and we will be happy to host you and provide any technical support regarding you hosting a session with us.